Ladies and gentlemen, thank you very much for joining me in this live webinar from beautiful Ojai, California. Our subject today is natural treatments for inflammatory skin conditions according to Ayurveda. So we're going to first learn about different categories of skin conditions according to Ayurveda, whether they're Vata, Pitta, or Kapha, or a combination, and whether the immune system is involved, or whether how toxins are involved, whether digestion is involved. We first have to diagnose the type of skin condition. You know, names like eczema, psoriasis, these are medical names that aren't really that valuable for us. Of course, we're both familiar with these terms, so it helps us communicate and have an idea what the client's talking about if they say, oh, I have eczema. But in fact, it doesn't help me too much when it comes to treatment. I still have to see the condition. I still have to analyze the person's overall health. I have to see what they're eating. And, you know, I have to look at their bowel movements, their digestion, to understand the causes. Whenever you're treating people, as I tell my students, the first objective is to identify the causes of why the patient has the conditions. We don't just jump ahead and say, oh, I have eczema. Oh, take this. I have psoriasis and take this. There's no such thing in Ayurveda. Every person is individual. Every disease or imbalance is individual. So psoriasis is a many different you know, levels of it too. I mean, stages of it, degrees of it, you know. So, and it may be easier to treat in one person than another person. So if 5 people came to me with acne, for example, I could treat them all entirely different with entirely different herbs, because the causes are different, or the types of their skin condition is different. So let's just move away from the medical terms. And if you have a skin problem, or you know somebody with a skin problem, then you know we need to understand it first. So that's what we're going to do first. We're going to break down into at least some of the major categories and look at the different types of causes for skin problems. And then we'll look at dietary guidelines for the different types. So, you know, we're really going to be, you know, talking about treating at least 3 different types, major categories of skin problems. And then, so that means 3 different types of diet. And then we're going to talk about herbal formulas for, you know, all 3 different types. I mean, there can be some overlap in some of these herbs and some of these formulas, but still they're very, will be very unique as we see. So first, let's look at the skin, you know, as per Ayurveda. We look at the gunas, or the qualities of the skin condition. You know, skin is, you know, by rasa datsu, it's our tissue, you know, and it's coming from, you know, affected by our blood, our rakta. So this rasa and rakta, this is our tissue and our blood. These are the tissue that we're talking about. If you have muscle pain, we're talking about muscle tissue. If you're talking about joints, we're talking about joint pain. But here we're talking about, you know, our skin, which is our, you know, we call rasa, which is this liquid just under the surface of our skin, and the blood. These are the 2 factors. The organ that's involved is usually our liver. So you're going to see that almost all these skin conditions, we're also treating the liver and purifying, cleansing the blood. Almost all conditions that involve the skin, there's an element of the liver involved. So let's start breaking them down into 3 categories. The first category, as per Ayurveda, Vata, Pitta, Kapha, the first category is Vata type of skin conditions. What are the qualities of Vata? Cold, light, dry, rough. So if your skin, if you're cold by nature, you're not a warm, hot, sweaty person, but you're generally cold, and you have dry, itchy, rough skin, this is whether it's psoriasis, which is, you know, very dry and itchy and flaky, but doesn't necessarily mean it's red and hot and burning and pussy. It's just dry and itchy, flaky. So these are the qualities that we're looking for. So I would say dry. I would say skin is rough. Under the elbows is rough skin. There's rough around the feet. There's rough patches in the person. There's flaky, dry, flaky scalp, you know, itchy, you know, and you can see the white. When you scratch, you can see the white lines. You can see the person is very dry. Often the tongue is dry, the mouth is dry, the colon is dry, you know, so you know that dryness is one of the major factors causing this skin condition. If it's a Vata type, that means it's a Vata type. See the skinny, cold, dry person behind me there? It's a Vata type. It's usually going to be a thin, cold, natured person. So that's the Vata type, dry and itchy. It could be pimples. Pimples are going to be black and hard, not pussy, but like blackheads. And the skin problems can be dry and itchy and flaky. Now, we could have combinations of these, but we're going to cover that. So the next type is the Pitta type of skin condition. That's this person right there in this little, chart behind me. This person has a warm body temperature. And you can see the skin problems are red. They're red. And there's a burning sensation. They can still be itchy, but it's kind of like this heat, burning, itchy, burning hot. And it's feeling hot. And when you get outside and you sweat and the sweat comes off, it burns. And even worse, and if you take cold shower, it feels better, so that's, and then it's a much more, it can have the immune system involved too, where it's getting inflamed, so this is a Pitta type of skin condition, red, burning, hot, inflamed, even can be painful, like it just feels hot. But the key word we're looking for is burning and red, very red. Psoriasis, of course, is in this category. And it can be a combination. It can be both Vata and Pitta. Eczema can be both. Some people can just have eczema dry and itchy, and some can be dry, red, and itchy. And they can have dry and burning. So now you have two doshic imbalances. It's dry and burning. Just like we live up in the mountains here, and we had all those fires a couple years ago. Well, we only had the fire because it was dry. If it wasn't dry, it wouldn't have caught on fire. So the dry was the underlying cause of the fire, not the fire. The fire wouldn't have came if it had been raining and it would have been dry. So the dryness was the underlying cause. And then later, it caught on fire. But even the dryness was bad for the environment, and the plants were maybe dry and dying and things like that. So it was still bad. But when it caught on fire, it just got worse. So that's like dry skin. Like it's so dry and itchy for 10 years. And then eventually it splits, it bleeds, you're scratching it and it's red, and then it gets infected. You can see it's the same way. The dry was the original problem. And then it became inflamed. Like your heel on your foot, it can be dry and cracking, and then dry and dry and dry, and then eventually it cracks and splits, and then it's bleeding and it's red, and then it could get infected. So you can see how dry can be an underlying cause of skin problems that can lead to also burning pain. But not all skin problems have the dry. Some are just burning and hot and even oily and even pussy. So the third category is the Kapha type, is pussy, like a whitehead, pus coming out, or you could have psoriasis. It's red, where it's a combination of pussy plus red. So this is like Kapha plus Pitta. It's pussy, oily, hot, burning. So now we know it's pussy and oily plus hot and inflamed. Or it can be dry and hot and inflamed. That's a Vata and Pitta. So first you need to categorize it, or at least if you're my patient, that's the first thing I have to do is I have to get your skin in a category, because it's an Ayurvedic system, an ancient system. We're treating, not, some medical term. We're treating these underlying causes. We're trying to create a balance, not just put on something topically, but, solve the condition once and for all, partially by just, educating the patient to know what's making it worse. Because generally the patient's not aware that what they're eating is making the condition worse. But once you understand, let's break it down again. Dry, Vata type, burning and red, Pitta type, oily and pussy, Kapha type. Okay, let's put it in these three categories. But in fact, you could have any two, and all three can be combined together. This is a more serious condition when you have more than one doshic imbalance. So it's easier for me to just treat somebody who's just dry and itchy than it is for me to treat somebody who's dry, itchy, and burning. You know, because now we have two imbalances. So that's the first thing we need to do, is to get classified. Second thing we do, so now hopefully you know you have a dry Vata type of skin condition, or you have a red hot burning type of skin condition, or you have an oily pussy skin condition, or a combination. But for conversation's sakes, we're going to just talk about these three. So now we have to look at the diet. If you're dry, then, you know, we have to get rid of this dehydration. I mean, you can't say, oh, here, take this ointment for your dry skin, keep putting on oil. You know, there's an underlying cause. That's the dryness. So the dryness has to go. So this means the person has to be hydrated. A lot of people are just drinking water and urinating it out, and they're still dehydrated. So generally when this person is dry, give them fruit juices, fruit juice, pear juice, apple juice, blueberry juices. Give them warm teas to sip all the time. Take out all dry foods, crackers, nuts, chips. You've heard me say it 1,000 times. Don't be snacking on crackers and nuts. Snacking on nuts is a bad habit. So you need to get rid of this dryness, this dehydration to the mouth, so the mouth isn't dry anymore, and the skin is not dry. And that could take a couple weeks of having soupy foods, or even oily foods, more butter. Butter is actually indicated when you have this dry, itchy skin. A lot of people think, oh, butter's inflammatory. Oh, I can't have any butter. It's going to make my skin condition worse. Well, I say, well, you're here. Your skin's still looking not good. 1 year you haven't had any dairy, and did it help? And they go, no, not really. So, you know, this is the problem when you don't know what you're doing and you're just guessing on yourself, you know, self-treating. Because your skin's dry, really dry, then butter is actually helpful to your condition. Now, if you have the oily, pussy one, you can't be having, you know, butter. But if you have dry skin, butter, dairy, not milk. I didn't say milk. I said butter, ghee, oily foods, more oil in the diet, and more hydrating diet, fruit juices, soups and stews and soupy rice and things like this for a few weeks. That'd be the dietary guidelines. It's a big subject, but I'm doing quick. Now, if you have Pitta type of inflammatory condition, more like psoriasis, red, or there's an autoimmune condition, and you know that it's really getting inflamed and painful and red or bleeding. Whenever there's any bleeding, that's Pitta. Pitta gati raktadhatsu, means the Pitta is gone in the is in the blood and in the rasa. There's too much Pitta. Pitta means fire. There's too much fire. Well, Vata meant air. That's made it too dry. Too much air made things dry. So we added earth, water, and oils to hydrate and lower this air quality. But when it comes to Pitta, we have to avoid what? That's right. The nightshades, tomatoes and eggplant, paprika, bell pepper. If you have any type of inflammatory skin conditions, particularly psoriasis, you need to stop all the nightshades immediately. This is a big cause, and many other things are inflammatory, making the Pitta inflamed too. Alcohol, coffee. Even if you think, oh, it's only 1 cup of coffee, if I had $1 for every time I heard that. You know, this isn't alcohol. It's inflammatory. Vinegar, even fermented foods, kombucha. Drinking all this fermented foods, these are all heating. It's making your inflammatory skin condition worse. Any heating hot chili pepper, it's making it worse. You already got burning skin, you can have chili pepper. Tomatoes are acidic, nothing acidic, not even sour foods. No lemon, no lime. You know, this all sour is creating heat. If you ate, you know, drink a whole thing of orange juice and your body gets hot. You know, you need to be drinking coconut water if you're this hot burning person. You know, not maple syrup and sweet fruit juices, grapes, a grape cleanse, you know. So you don't want all sweet fruits when you're hot, burning, and pain, and no spicy, no nightshades. Okay, that's the Pitta type. We're moving quick here. And now if you got the oily type, well, that's a little obvious. No more fried foods, no butter, no cheese, you know, and no fried foods. You got to go on a somewhat low-fat diet. Generally, we give out sunflower oil. You can't be doing coconut oil if you have P.A.C.E skin, P.A.C.E type of acne problems. A lot of times if a person's body's dry and the face has acne, that's generally fast food, bad oils. I can often spot it, 20 odd something person, body's kind of dry and they're getting a lot of pimples. I ask if it's a woman, is it related to your menstruation? She says, no, it's always bad. I see you eating In-N-Out burgers and hamburgers and fast food. She goes, yeah. I go, that's it. It's that trans fat, that bad fat in the diet. Even if you're going to, the store and you're buying just like vegetable oil, this cheap vegetable oil, this is going to make this kind of fatty, oily pimples that you have to use a better oil. And too much meat, too much red meat, coconut oil, any butter, cheese, all need to stop. I mean, you got fat popping out of your skin. You can't be having, French fries anymore. So you got to think, you got to even you need popcorn, dry it out. If you got oily skin, your whole body's oily and you got pimples, you can have some popcorn to dry it out. So, one person, popcorn could make it worse. Another person, popcorn could help, because it's a very dry popcorn. So those are the 3 dietary guidelines. Now, there's other factors that cause skin problems. One, colon problems, constipation. Many people think, oh, I'm normal. Everybody, how many, what's your bowel movement? I'm normal. Well, how many times you go, well, I go about every other day. It's normal. And ask another guy, how's your bowel movement? Oh, I'm normal. Well, what do you have? Well, I go about 5 times a day, kind of loose, but no, it's normal. No, these aren't normal. It's normal to you because you're not looking at other people. You didn't study the subject. That was the problem, So, that was the problem there. You didn't study the subject, so then you don't know. But what you want is 2 or 3 bowel movements a day. If you're been constipated and you're just going once a day, we'll call mild constipation. But if you've been going 1-2 days without a bowel movement for a long time, then this is going to create autotoxicity. This gets back into your bloodstream and overwhelms your liver in time, and then you start to have skin discoloration later in life. You can get rashes, hives. The immune system can react to these toxins and becomes inflamed, and it's all due to your constipation. So you have to resolve the constipation. Anybody who's constipated with any liver problems, they're going to get colon herbs as well to just flush it out. Now, even if you're warm and hot, then we give you colon herbs that are a little cooling and flush it out. If you're cold and very dry, hard stools, then we're going to have more stronger, colon herbs to just like castor oil to just flush out these bowels and get things moving. It's a prerequisite. The skin is not going to get better if you're even mildly constipated. So if you have any skin problems at all and you're not having 2-3 bowel movements a day, you've already found one of your causes. Second major cause, the liver. The liver's job is to clean and filter the blood, amongst other jobs, making hormone, managing lipid levels in the blood, etc. But it's, filtering, cleaning out toxins out of the blood. So everybody who's got particularly long-standing liver skin problems, particularly if they're elderly, need to clean the blood and improve the liver function. And it's often due to years of constipation, which made the liver toxic because the liver just couldn't deal with all these toxins that you weren't eliminating in a timely manner that got reabsorbed into the system, and then the liver had to deal with them, and then the liver just after 30 years had trouble. So if you're 40 or 50 and you're getting a really bad skin condition, more than likely it's related to your liver, because a younger person isn't going to have so much liver toxicity. But of course, if you did a lot of pharmaceutical drugs, have a lot of operations where you had to have a lot of medication, or you did a lot of recreational drugs, or you did a lot of alcohol, then you could have damaged and weakened your liver early in life, assuming you're not doing it now. you need to go and clean this liver out. So you may have stopped this bad habit of drinking or pharmaceutical or recreational drugs, but it's still, you may have not reduced or eliminated the toxins from your liver. So you need to clean these liver out. So most cases with skin problems, we're treating the colon, we're treating the liver, and we're treating the digestion. Let's not forget the digestion. If your digestion's poor, you're creating more toxins every day. And maybe it's even constipating you. It's a big subject. I have many, many videos on different types of digestive imbalances and different types of digestive problems. But you should, basically understand that your digestion has to be good. So I can only give you the criteria of what is good digestion. First, good digestion is an appetite. If you're not hungry till 2, 3, or 4 o'clock in the afternoon, you don't have good digestion. Doesn't matter what you think, your digestion's poor. Good digestion, mark of good digestion is a good appetite. You're hungry. Sooner you're hungry in the morning, probably the stronger and better your digestion is. Now, there are people who have this acidity and heartburn and, and killer digestion, and they have to have multiple meals just not to get acid reflux or GERD. Well, that's the digestion's too strong. That's another imbalance. But more likely you have ama or toxins, and there's a heavy film on your tongue. You don't have much appetite. You're easy to get constipated, blocked up, feel heavy after meals. Even if you can't eat a lot of foods, like, oh, I can't have wheat, oh, I can't have dairy, oh, I can't eat this. Well, that means you have a digestive problem. We love to blame things. We love to blame, oh, it's the dairy's fault. It's the meat's fault. Oh, it's the virus fault. But, we have to look at ourselves and take responsibility. Our digestive system, needs to be robust and strong. And it's a huge subject, so I can't go into it much more. But you really need to improve your digestion. And the most common reason people have poor digestion is snacking, crackers, chips, having cold food, cold smoothies, ice cream, all of these type of things. These are making the digestions bad, eating late at night, cold pizza late at night, all of these type of things. And then the person doesn't fully digest it, and they don't have a bowel movement till the afternoon, or they're skipping a day. So these are underlying causes that need to be addressed. Otherwise, we're wasting our time. That's why I don't sell my products straight online. We're going to now talk about different herbal products that can be taken in different individual herbs. Some of these herbs, if you're familiar with Western herbs or Indian herbs, you may know some of them. But you don't know whether it's suitable for you. That's the issue. So it has to match you, and you have to take care of these underlying causes. Liver has to be cleansed, blood has to be cleansed, bowels have to be moving, digestion have to be moving. These are the prerequisites. So that's why when people come to me with skin problems, they don't go out the door with one little jar of herbs for their skin problem. They go out the door with something for their digestion, something for their skin, something for their bowels, and a whole new diet to not make it worse. And many things we're doing every day, like tomato sauce, will make all inflammatory skin conditions worse. So that said, it's a lot. 3 different categories, and there's other categories too, but like I said, there's combinations. But now we're going to talk about herbs that we can take, and you're going to see that the herbs are also divided into 2-3 different categories based on the skin condition. So let's start off here with the 2 main herbal formulas that I have. This is the first one here that we're using. And let's see if we can. There we go. Ayurvedic skin formula for Vata and Kapha. So this is for acne, itching, rashes, most skin conditions, but not all, not hot ones. And it's best to be taken with aloe vera, 1 teaspoon 2 times a day in a 1/4 cup of water with a couple tablespoons of aloe vera. This is made with the formula called Hari Dakan, which is 8 herbs, main herb being actually turmeric. Mangista, we're going to talk about Mangista being the premier herb for skin problems. And neem, many people are familiar with that. This is antiviral, antimicrobial. Khabir is an herb that's only used mostly for skin problems. Guduchi is an anti-inflammatory. and also helping to keep down, a Pitta in this formula, even though it's not a Pitta formula. So this is a person who's either Vata, dry, or oily, and it's very effective. Just common acne, it's working quite well. Rashes, doesn't work for psoriasis or the hot burning ones. This one is actually what we're selling most of the time now in this weather. We're getting a lot of cases every day, 1 or 2 cases. This one's acne, itchy, heat rash, burning skin, hot. This is more for like psoriasis. 1 or 2 teaspoons between meals in a cup of, warm water with a couple tablespoons of aloe. Completely different herbs, but you see mangista, still the first herb there. Kamaduda ras, which is a formula of cooling herbs. Little sandalwood. Shatavari, a cooling sweet herb. Aloe vera, turmeric, neem. Godanti basma, which is a very cooling basma. So this brings down the body temperature, brings down the heat, brings down the burning sensation, and really is very, very effective in a type of skin problem that's related to hot, burning, heat, sun. Well, this is what people are mostly having right now, and we have many cases and shipments going out with this formula in it right now. That's why we're doing this during the summertime when it's hot, because that's when particularly this Pitta inflammatory skin condition gets really bad. Now, we didn't talk too much about allergies, but there's also an allergic type of skin condition. And this is easy to spot because, you can have external allergy, like you're touching your skin and it's touching your clothes and your skin becomes itchy. And we should always look at what the clothes you're wearing, the detergent you're using, the soap that you're using. You can't be wearing polyester clothes and expect your skin to get better, So, but when we can tell that there's an allergic reaction, like they're putting on a uniform and they're getting a rash, or there's something that's triggering it. There's a trigger. It's just not chronic all the time, but it's coming and going. And there's maybe they're eating certain foods, and then they're getting this rash. So in that case, they're back to the digestion. We have to give them some. We have a food allergy formula, but funny thing is the skin allergy formula is very similar to the food allergy formula. So we'll take a look at that one there. Skin allergy formula. This is like itchy, rashes, fungal. Like you can see fungus growing on your skin. You see, it also says can use for respiratory congestion. That's, and there's that guduchi, anti-inflammatory, turmeric, pepper, ginger, cinnamon, vidanga, which is a laxative cleanser. There's triphala, haritaki, bipataki, amlaki, musta, which is a cleansing type of cooling herb, trivet, which cleans out the gallbladder and the liver, flushes it out, the heat from that level. But the main herb is this guduchi, which is this anti-inflammatory, an immune modulator. Guduchi is very famous for modulating the immune system to strengthen immunity without doing it. So, we have another form, amlaki rasyana, also a immune modulating herb. So if we know that the immune system is part of the problem, then we give out this amlaki rasyana, which is in capsules, and I don't have it right in front of me now. And this modulates the immune system. So whenever there's an autoimmune condition in the skin problem, we have to add some other herbs to modulate the immune system. So that's for the rash. Now, if there's a lot of heat, a lot of burning, and acidity, then we use this one here, sometimes in conduction. Pitta balance. This is reducing heat, acidity, burning sensation. And here, all cooling herbs. There's that kamaduda ras again, which is a formula. Pishti, mukti pishti, which is powdered pearls. Punchment, 5 types of things from the ocean shells, basically. Guduchi sattva, which is a basma for very cooling, little licorice, little fennel. So very cooling, and this can bring down the heat, bring down the burning, and take care of the acidity at the same time. Sometimes I'll combine these two together right here. When the person's really hot, burning, pitta, acidity, rashes, red face, then I'll combine these two together here. See, I'll give them the Pitta balance to really bring down the heat, and then the inflammatory skin condition. I'll just say take 1 teaspoon of each one 2 or 3 times a day, and it's amazing. 1, 2, 3 weeks. You saw the testimonials, and you can go see more that I have. So, and then I would combine it with 1 of 2 teas. Most likely this tea, I would have them be drinking this tea during the day. And, you know, we call it blood detox tea. It's a very, typical tea that's cleaning out the liver. We can see dandelion root, burdock root. These are typical liver cleansing roots. Oregon grape, that's used in infections and colds, so it's antiviral. And we put some turmeric in there for the anti-inflammatory, chopped and sifted. But the key herb there, look, sarsaparilla root. Sarsaparilla root kind of smells like root beer, and it's got a nice, pleasant taste. It's cooling. It's very good for skin conditions. So this is a very excellent form, particularly just minor skin conditions, minor rashes. It will take it right out. But this is a common combination that I give here. Take my Pitta skin formula there for red burning, hot, itchy skin, and then drink 2 or 3 cups of this during the day. You do that 2-3 weeks, follow the diet, no acidic foods, tomatoes, no spices, no hot, no fried foods. 2-3 weeks, you can see just the skin condition getting better right away. Now, if the person's not hot and burning, and it's just more either dry and there's not or pussy, then we just give them the standard liver tea, dandelion, burdock, milk thistle, coriander, turmeric again, and cardamom seeds. It's a little warmer. It's cleaning out the liver a little more because it's got the milk thistle flushing out the gallbladder. So this is a common combination here. We give out the skin formula, internally after meals, and then we give them a bag of the liver detox, and great results, a couple weeks. Now, if their liver is really an issue, I do have other issues. If there's any gallbladder problems, then often I put in the gallbladder formula before meals too. But if I really think that the liver is the main problem here, then particularly if it's pussy and hot and oily, and they have cholesterol, fatty liver, high cholesterol, pussy type of skin condition, then I know the liver is a big culprit. So I may also include more liver tonic. This one's for kapha. So, cleansing the blood, decongesting the liver, lowering. There you got mukti, the premier liver herb for Ayurveda, amlaki, punaravi, kalmegs, very bitter herb. There's the manjista again. So even though that's for skin, and bhringraj. And so this is a very powerful liver detoxifier. It will help with fatty liver, cholesterol, and a kind of a pussy skin condition. So a person could have all 3 of these, the skin formula, the tea, plus the liver formula. If the person's dry, then it's very dry. I don't want to give them too much of dry herbs, but if I really want to focus on the liver, then I can give them the liver ghee, which is the liver herbs in ghee. And there's neem first, guduchi, tricotue, which is ginger, black pepper, and pipali. There's manjista again, malaki for the liver, turmeric, and some bitter melon. So it's like bitter ghee. It's another name for it. Sometimes I even give the bitter ghee to put on the skin condition, particularly if it looks infected. Then we put it right on because it's got the neem on it. So sometimes I tell them put it on the bad spots and take 1 teaspoon once a day for the liver. And that's instead of a dry herb, it's in the oil. So this is for the dry person. Also, I don't make these soaps, all these formulas I make, but I do recommend a few different soaps. I like this company a lot. If a person's a little more on the oily side, kapha or pitta, then I like this soap here. Sandalwood is very cool, and you notice that's in some of my skin formulas. Sandalwood, turmeric, the anti-inflammatory. It's a very nice soap for skin conditions, and they all have neem. See, they have neem. I want the neem in there. It helps fight infection, and particularly when people are scratching it and it's could be getting infected. Now this one is more for dry skin. It's using vanilla and neem. You see, it says for dry skin, and it's very soothing and very pleasant. It helps with the itch. So I'd probably give them a skin formula, colon formula, liver formula, some tea, and change their diet. That's how I get fast results in just a couple of weeks. Well, people have been working on these skin problems for years, even often decades. Now, you noticed a lot of those formulas said take aloe with them because aloe is very good for skin problems. But we have a couple types of aloe. If the person's constipated, then we want to have them aloe whole leaf because that's got the laxative effect, taking the leaf. The leaf is the part that's the laxative. And if they're already having, loose stools or, or regular bowel movements, then we give the aloe inner leaf so it doesn't have the laxative effect. So aloe is very effective. Almost all skin conditions, we provide it. Now, when it comes to topical, we have some topical things too. If it's a hot, burning skin condition that's dry, we sometimes give out the Pitta oil, which is a cooling oil. We have an eczema oil for dry, itchy. This is made in India just for eczema. And a great tip here you're getting here by being on this webinar. This is the premier oil for psoriasis, or hot, burning, itchy skin. It's called 777 oil. All Indians know it. It's it's 777 oil. It's used for hot, burning psoriasis type of conditions. Now, there's certain things you need to know about how to take it. You put it on the skin, and you should go even out in the sun a little bit and have it soak in a not direct sun. That's the proper way to do it. Another thing we can take externally before bed is this is fermented aloe vera. We call it liver and colon tonic, but basically it's fermented aloe vera, and we use it sometimes for a lot of skin conditions, and it's a mild laxative, but it's herbs basically in aloe vera. So that's often like an adjunct. It's something that I may put on. If it's really look infected and it's got yellow on it, and it's it's just really like a bad, nasty looking skin problems where it's going bad, then we're going to put some neem oil straight on it to get rid of that infection. We use this also for fungus and toe fungus. We put neem straight on it, and that was easiest way to get rid of toe fungus. Another adjunct, which means something I can add along with the package. If the person's very hot and burning and then we can give shatavari ghee. Shatavari ghee is very cooling, bring down the body temperature. They're hot and dry. These are not necessary, but supplemental. Here's Manjista, the premier herb in Ayurveda for all skin conditions. It's a red. Other herbs that are really important. Amlaki is for, the premier herb for all liver conditions and very helpful with the skin. Of course, in Western herbalism, we have dandelion root, which was in both teas. Burdock root, which was in both teas. And a milk thistle seed. We have the whole seed. We just grind it up a little bit rough, so break open the seed for the tea. And we also have dandelion leaf as well. So those are, Western herbs, and the sarsaparilla, which I'm out of, it's only in the tea. So, we combined. So these are why we're getting the very fast and quick results, because once you've had it diagnosed and you know exactly the causes, they're eating the wrong foods, their digestion's poor, they're constipated, they have a history of liver toxicity based on the past, and and then if it's dry or hot or a combination, or hot and oily or a combination, then you've got them in the right category. Then you can give the right herbal formula to match that category. If you pick the wrong formula, then you could actually make the condition worse. So if you have a hot, burning type of skin condition, like psoriasis, is hot, burning, itchy, and you pick the wrong formula, it literally will make it worse. You'll feel worse instead of better. So if you don't properly diagnose, you can't treat. And if you don't change the diet, you haven't eliminated the cause, because most people are contributing to their health issues through their diet and eating habits. Even though they may say, well, I eat healthy, I eat good, but you may not be eating the right foods for you. Just like somebody with psoriasis could be eating organic tomatoes from their garden, and that could be making their whole skin condition worse. In fact, this is what's happening right now. People have gardens, they're getting this red, burning hot skin, even over their whole face. And they're just eating tomatoes because they're growing in their garden. They stop the tomatoes and it's already getting better. Sometimes when I meet the client online, Zoom or Skype, you know, it takes a few days for the herbs to get there. But meanwhile, I tell them to change the diet. And when I ask them, did you get the herbs? Everything going okay? And they go, yeah, just stopping the tomatoes, the hot sauce, my skin was getting better before the herbs even showed up. And I go, that's correct. See, so people are causing it. Same with constipation. You know, once a person is they're constipated, once those bowels get moving with the herbs, you see the skin get better already, you know, within a week, just getting those bowels moving. So same with liver toxicity. You start taking the liver herbs, 2-3 weeks, your skin's getting better with nothing else but just cleansing the liver. So, you know, you really, this is what we call holistic treatment. Everybody talks about, oh, I'm holistic. But then if you say, what do I take for this problem? They just say, oh, take this. Well, that's not holistic. You have to look at the whole person. You have to look at their diet, their lifestyle, their digestion, their elimination, the different organs, the liver, the spleen, the colon, you know, to see their condition. So we know, do they need to be treated? Are they a factor in this condition? So it's never so simple as, oh, I just have, you know, a skin problem. There's always other issues involved. So I hope that helped give you an idea of the potential for resolving skin issues. And I think I'm very good at resolving skin issues with so many years of practice and so many patients over the years. And of course, you know, I have all these herbs and I make all these formulas myself and teas. So, you know, I know that they are of the highest quality. And that's very important because just like with a food or a coffee or any, you know, it's the quality is what's important. I mean, you can't just say, oh, I'm drinking coffee. I mean, there's fresh Kona coffee from Hawaii from a freshly roasted bean. And then there's, you know, old coffee beans or instant coffee. So, but people all call it coffee. Same for herbs. You know, if you just buy cheap herbs in the Indian shop or, you know, or something like this, they may not just have the potency and the quality that you really need to resolve your health conditions. So you have to have quality herbs. You have to have a right formula that's suitable for you. You have to change the diet. You have to look at your bowel movements. You have to look at cleaning out, improving your liver function, and your digestion has to be maintained during your time of treatment. So most skin conditions can be a little stubborn. You know, it always not like quick. You know, they start to get better, but they don't resolve for months. Most people are doing like literally 3-4 jars, sometimes 4 or 5 jars before the whole skin problem is done. But the beauty of these herbs is that once you've resolved the skin issue, I mean, it can go away until you know, create it again through your eating the wrong foods and the wrong diet, and or your digestion gets worse or your constipation comes back, or, you know, then the skin problem can come back. But basically, these herbs are treating the underlying imbalance and then improving the, you know, the tissue, the rasa, cleaning out the rakta, the blood, and then the problem's gone. You know, of course, with medication, you know, often you're having a steroid or something to keep the inflammation down, which is lowering your immune response. But once you stop the medication, the condition comes right back. So not so with herbs. You know, once you've done the work for those 3 or 4 months, following the diet, taking the herbs, you could be clear. But you'll probably still have to follow the diet for most of your life. So I hope that gave you an understanding of how these skin conditions can be treated successfully and within a few months. And as you can see from my testimonials, I have many, many testimonials from people who had skin conditions literally for decades and found results in a matter of weeks or months, you know, on this type of custom protocol. So feel free to contact me if you need help with your skin condition. If you have a minor skin condition, then, you know, maybe some of these dietary changes and some minor, you know, some herbs to clean out the liver and the colon may be enough for you. But if not, then you're better to get professional help and have me prepare, you know, specific herbal formulas for you and give you a specific diet so we can take care of this problem and it doesn't continue indefinitely. So thank you very much once again, ladies and gentlemen.